All right, thank you for staying with Citizen TV. We're still going through the commitments that Kenya made during the ICPD-25 conference, which was marred by controversy, but we're now unpacking the commitments made verbatim and how practical the approach should be in order to ensure that they're implemented. We want you to weigh in on this discussion as well. 22422 is the SMS line. At Trevor Mbija at Citizen TV Kenya, use the hashtag Daybreak. We're on point number 3 and 4. We've spoken about point number 3. Let's bring up point number 4 and talk about it. Providing relevant population data at all levels. That is the highly summarized version, but from the president's speech, it was to enhance the capacity of relevant government institutions, to increase availability and accessibility to high quality, timely and reliable population and related data at national, county and sub-county levels, disaggregated by income, gender, age, ethnicity, migratory status, disability and geographic location by 2030. So Dr. Josephine, you're the Director General, National Council for Population and Development. How have you been planning if this data wasn't available? Because we are planning to have it by 2030. How have you been planning all this time?
Well, if you look at the statement, Trevor, is to enhance. Yeah, it means there's already something which is going on, and data is from all sources. Even the just completed census, is a very huge source of data in terms of planning. I know it's controversial, but also it shows some of the issues which have the misunderstanding, because when we talk about migratory data, for instance, in census, it showed very clear where people are. So you cannot expect people to sit at home to be counted there when they actually work in a different place. And planning for those people, we need to do it where they are, not where they come once during Christmas or something. That's why data is so important, especially for the people providing services, so that they are able to understand who they are planning for. Is it the old, is it the young, is it men, women, and so forth? Because we know there's a lot of diversity in our counties, and that is the beauty of devolution. Yeah. So most of this data needs to be strengthened so that we are collection of data and interpretation of data, so that we have county-specific data or information which the county leadership can be able to use to help or to provide services for their people.
But how do you streamline that process when the county chiefs themselves are disputing even the census numbers, for example?
Well, numbers don't lie. So we just need to convince people on the methodologies and ownership. So right from before we collect data, for instance, we did what we call service delivery indicator survey to tell the counties the state of their health services. This was like about 2 years ago. And the buy-in there was that the information was actually collected by county nurses and clinical officers from their own facilities. So they owned that information. So it's very important during planning for data collection that there is a public participation and there is ownership of the process, so that then the information which comes out of there is easier for everybody to accept and use. Because many people, many leaders are sitting in the offices and planning with no clue. In that ward, how many children are there, how many persons with disability are there, and so forth. So it becomes just, it doesn't help anybody.
But this data can also be misused, especially by maybe politicians, the migratory patterns. So when during the elections they say, my people came back from the city. And that's why you're seeing these numbers. They're different from what you had that the population is. How will you ensure that the numbers are not misused by any of these crafty people in between?
Yeah, you cannot curtail where people will be when. I live in town, but my vote is from my village. So come voting time, I'll go home and vote. And that doesn't mean it has changed anything, any dynamics. I just feel maybe I need to elect a leader to develop my home area. Okay. Yeah, so I don't think it's illegal to do that. But for planning purposes, the day-to-day service delivery, water, electricity, sanitation services, immunization services. We need to know, for instance, Nairobi has 4 million people. Yeah. We know many of them go home you know, in fact, that may be at night. During the day, there may be 6 million, you know, because people work in Nairobi and live elsewhere. So I know that census was done during the night, the first night, and it showed Nairobi has 4 million people. But we know, for instance, that number is maybe higher than that during the day.
Okay.
So you need to be able to plan for that population, not, you know, somebody living in Nairobi like me who comes from Tharaka Nithi. You plan for me there, and I am rarely there.
Okay.
So plan for me in Nairobi, because that's where I'll need the water, that's where I'll need the road on most of the time in the year.
Okay.
So I think we cannot overemphasize the need for data and really reliable data which can be accepted.
Okay.
Yeah, but the issue of participation and involvement of people before you even have the information, so that they can own that data.
It's paramount. All right, let's bring in point 5 and 6. I stayed on that point because mostly that was on your docket. But let's bring in point 5 and 6 and see what they're saying, unless you want to jump in on that as well.
Yeah, I think the issue in terms of the data, the risk here is more what is the implication. I think that's why there's a lot of it means less resources. I think that's what's probably, and then issues of the votes, who wants the vote. But key to that point also is that issue of the timely quality data, which is quite important, because having it a timely, not relying on data of 2014 or 2010, but do we have data which tells us what is happening in this particular area or in this particular sphere. And Kenya, enhancing that capacity, especially in Kenya where we have technology is quite advanced, I think digitizing that process is quite crucial.
There's a big concern about elimination also, whereby now some constituencies may be done away with because of the numbers. So people are saying if I'm counted in Nairobi and then my constituency back home is taken away, but that's where I still vote, there's a disconnect in between.
I think that can be managed politically, and I believe that's a political process. So it should be just.
You have to stay away from the political side of it.
And then issue of the disaggregation, so that we know who is affected. And this, especially looking at from the health perspective, you want to know. Let me speak from the health, because that's why I'm more comfortable. You want to know who is having what and in which particular region, because even if you go to the subnational level, the county level, we want to know who has malaria, which region or which particular area has people more affected by a particular disease or by a particular problem. So that is, and this also goes when you're looking at maternal deaths or infant deaths, which particular region. So that sub-analysis is quite important. So even to that extent that we already have even the census being released, there will be that analysis which goes much deeper and give us more better perspective. I think this is quite key in the data, so that we don't just generalize.
Okay. You want to jump in on this, Sandra?
Yeah, no, just to agree with Dr. that we need to, what disaggregating data by region, by gender, by age and disability means is that we are humanizing the statistics, because it is the data that is being used to make decisions about our lives. And so data is power. And when, right now people are saying qua ground things are different. When we say that, what does that mean? It means that the people whose lives we are actually making decisions for are completely locked out. We did a listening exercise in the community recently in the Nairobi informal settlements. And some of the information that was coming out was startling. We're talking to mothers who are experiencing disrespect and humiliation in hospitals, but when you interact, when you lift that conversation and bring it into the policy dialogues, there seems to be a blackout, like, hey, we didn't know this was happening. So that already tells me that the data and statistics that are there, the data around maternal deaths, around maternal morbidity, are not updated, they're not reliable, and they're not humanized. And so there's a need to do that, because the data is power, and that is how decisions are being made about our lives.
All right, let's bring in point 5 and 6 and talk about them really fast as well. Number 5 is to harness the empowering young people by investment in health, education, skills training by 2022. And number 6 is attaining universal basic education by ensuring 100% transition of pupils and implementing the CBC. So that is a summarized version, but on paper it was to harness the demographic dividend through investments in health and citizens' well-being, investments in health, education and skills training, employment creation and entrepreneurship, rights and governance of empowerment of young people by 2022, as outlined in the Kenya Demographic dividend roadmap. All right. Geoffrey, I'll start with you on this one, the issue of employment of the youth.
Yeah.
This is a promise that has been made all along. What is going to be so different this time? Because now the commitment is to 2022. What do you think the government needs to do to ensure that there's better employment levels now?
I think the government needs to really empower this youth so that they can take or they can create their own employment.
Yeah.
Because the employments that are there are very minimal to cater for all the youths that are jobless. So I believe when they are empowered and given skills to partake or to create their own opportunities,
yeah,
they will be able to create for their own and for other youth that are there.
Okay. And Sandra, this is also another issue for the youth. Skills training, employment creation, entrepreneurship, rights to governance and empowerment by 2022. We've seen these commitments before. So how practical should this approach be now? What difference should be there?
I mean, listen, we talk about youth participation, we talk about leveraging on the skills, the energies, and this thing of bringing them to the table. What now needs to shift is actually listen to them. But when we're listening to them, what should have happened before that is that young people are equipped with the necessary skills, the necessary resources, the necessary knowledge to then engage in this table. And so when we talk about employment opportunities, I know in Kenya last year we did a report. A report was released around the next generation. How do we secure the next generation? What are the hopes? What are the fears? What are the aspirations?
Yeah.
And the three key things that came up was one, education, where they need education to be meaningful, and they need education to give them access to employment later on. Then the next issue that came was youth unemployment, which is a big issue that is currently facing young people, especially in Kenya. Then the third issue is around voice and engagement. So all of these things are interconnected.
Yeah.
If you want young people to powerfully show up in a space, powerfully show up in decision-making processes, they need to be resourced with knowledge and skills that speaks to our education and our curriculum.
Yeah.
That's why that conversation is very important. And then it also speaks to how we engage them in the workforce. Is the workforce ready to engage the 2019 young person who is digitally savvy, who is very multi-talented,
yeah,
who is very connected to global trends and global thinking.
Yeah.
So how adaptive are our systems to enable young people to access opportunities in education, in employment, and to air the views and air the fears and their hopes in decision-making processes. So that needs to shift.
Okay. Dr. Mbai, what is the strategy here? Because now we are about 3 years off, but this promise was made like 5 years behind.
Yeah. I think, Trevor, what is the situation here is we have a big cohort of young people as we speak. So how do we then harness them to give a dividend to the country? I think that is all what this is all about. And there was a roadmap which was developed, a demographic dividend roadmap leading us to really invest in the areas which would make a difference for the country and for the young people.
Yeah.
And that's why you've seen deliberate effort by government in certain specific areas like education, because we need the young people to be educated, not just educated, also skills development. I think that comes in another one, very loud commitment. To have the young people educated in a manner that they are employable. You know, that's why you see the TVETs have come up, you see the issue of internships, so that those who've come from universities really can get some bit of competencies in the real industries and in the real offices.
But even those ones still have controversy. CBC, for example, is one of the issues that was very controversial. Parents say they don't understand it.
I think it's more of what we said earlier, involvement and getting people to understand. You know, this top-down thing must end, and the Constitution was very clear. That's why the issue of public participation is actually in the Constitution. But also, Trevor, Kenyans, we are a bit difficult to engage. Yeah, I don't want to say the other word. You know, we want to interrogate every single thing, even when it's really not that bad. And you've seen a lot of, in the CBC arena, for instance, the teachers, once they were trained and they understood what it was all about, they are on board. But even as we speak, there are others out there who are still fighting the CBC. So I think there has to be, how far do we go in terms of engagement?
Okay.
But the government is actually investing in those areas which are priority in the roadmap, to try to empower the young people.
Okay.
And that's why the transition up to college and up to higher institutions, the government is very clear that transition needs to be there. Okay. And then the other big four agenda, you know, so as to create opportunities for employment.
Dan, what should the approach be here? Because we're talking about number 6, attaining universal basic education, ensuring 100% transition. But the main concern has always been infrastructure. What are they transiting to? And where are they from? Because there's some far-flung schools that don't have enough capacity, they don't have enough infrastructure. They end up alienating more people. And there's some people who are in the marginalized areas. What should be the best practical approach to ensure this actually happens and it's quality for everyone?
Okay, thanks, Trevor. It's a heavy one, and the sense, one of the things I would just need to highlight here is that this commitment which is being made is made on a foundation that there's already an existing medium-term plan by the government, medium-term 3. So it's already within the development plans by the government. So there are various institutions which are working on this.
Yeah.
So it's not just something which is going to start from now on, but it's already something which is in the process. Yes, we take cognizance that some of the places, of course, look so pathetic. They are so congested that compromises in the quality of education. So what needs to be done, probably in just one, it needs to improve on those areas, expand, improve the infrastructure, whether it's at the time of accommodation for the places where there are accommodation, for those places where classrooms are needed, need to expand the classes, because that's also an incentive for people to go to school, because when they go to school and then they don't get the quality services, they're not attended to, they tend to run back. But if we want to attract them, then we have to improve the infrastructure. Okay. One is in terms of the facilities available, and two, in fact, in the teaching, the human resource that is the teachers themselves, that will take care of that, so that we ensure that even those who, like now, we have 1 million plus who have just finished, whose results have just come out.
Yeah, and the government says they'll be 100%.
100%. So we need to space for 1 million students in the secondary school, whether it's a day school or it's at the boarding schools.
Okay. And Dr. Mbai, Mohammed Nadir is not very happy. He says they cannot fully commit number 5, investing in health and education. How will they do that? Number 5 is the one we talked about, harnessing the demographic dividend through investment in health and citizens' well-being, education and skills training, employment creation and entrepreneurship. He feels that there's no strategy for this.
It's a lot of strategy for that. And I think that's where Dr. was coming from, that some of these things are in the medium-term plan of government and the Vision 2030. I think there is a roadmap, which is a multi-sectoral roadmap, which says in health, where should you be putting most of your resources? Because, you know, there are many, many needs. I mean, like in the Ministry of Health, ranging from maternal deaths to even jiggers, all those are all medical problems, isn't it? So where then should they be putting their money in terms of priority?
The most pressing need.
Yeah, the pressing need. The same with education. What is the most pressing need? You saw in the last 5 or so years, the government has put more effort in TVET. Not that the universities are not important, but there was need to create a cadre who are competent, you know, in terms of technical skills, because we are having graduates who then cannot even fix a tap, you know. So, you know, those kind of things are actually there in the frameworks of government.
In fact, let's bring that up. It's point number 7 and 8. Point number 7 and 8 speaks about what Dr. Mbai was talking about, to improve the employability and life skills of our young people by enhancing quality and relevance of technical vocational education and training, that's TVET, in partnership with industries and private sector, and also to fully implement competency-based curriculum to improve skills training by 2030. But now that is also another concern there, and Geoffrey, this also is mostly for the youth. How come the youth still are not buying into the idea of going to TVETs? They'd rather go to the university. Well, is it because of the way we were brought up by our parents? What is the problem here?
Yeah, I think that contributes a lot, because Also, our parents believe that when you, you go to the university, is what is the best. So when you go to, even when you go to this TVET, the society, the people who are around you, they think that you have not obtained anything.
Yeah.
Yeah.
So that is where the concern is. How do we change that mindset, Sandra?
First, by understanding that access to education is a right, and that is what empowers an individual to be functional in society.
Yeah.
And that means whatever curriculum that we have in place, whether it's TVET, whether it's the mainstream education that we find in our other tertiary institutions, is that does a young person going through this system, are they able to be functional, you know, in all spheres of the system, if it's the economic system, the political system, are they able to properly harness their potential to thrive and prosper? And I think that is why, even as we're having these conversations, they need to be in the table. You need to be engaging young people in these conversations. It's not really about what we think is best for them. Again, I said earlier that young people in the 2019-2020 youth is very connected.
Yeah.
And very plugged in, very woke is what we say. And so they need to be here, they need to be engaged in this conversation to influence access and to influence what they think is relevant for them.
Dan, what do you think? How do we ensure that now there's more skills-based training rather than theoretical training?
One is just to make those create those opportunities, so you expand the facilities that provide, so you build more institutions for the vocational training. I think we both look at what even the CS for education, my teacher as it's why in the medical school, Professor Magoa, mentioned that even in his village was looking for someone to do some work for him, and it was not very easy.
Yeah.
I look at it in some countries, you find such kind of, maybe those who are in masonry are actually earning good money, better money than even some of the highly educated. So it's a question of, at the time of employment, for those who will require employment by other institutions or firms, must we insist on a university degree? Can we have just those? Because if you want
also a mind shift of the private sector and the private sector employing.
Yeah, so if you, because I'm probably would say master's advanced degree,
an added advantage.
Advantage, or even just that's not even just added, but that's the minimum that you're taking. So someone who probably is more skilled will not be able to get this job, and then there he or she is. So we'll always aspire to get a university degree, even if they don't have that. Many of the university degrees probably were not prepared to provide that kind of training. So based on the issue of also highest number of transitions, proportion of in terms of transition from secondary school even to the university to the tertiary colleges, then it means that there's a lot of congestion also. To the extent that what could have maybe 2 people who could have shared a machine during training, you have 10 of them.
You have 10.
And we see this across board, even in medical school.
Dr. Mbai, you're the one who kicked off this conversation on TVETs. It's one thing investing in TVETs, and it's another thing having people actually go there. So what is the strategy?
I think there's been a lot of advocacy, if I may say so, right from the villages. Like he said, if the parents are looking for you to have a degree, then it's very difficult for somebody with an A to opt to go for TVET. I remember, maybe practically, my daughter wanted to do environmental science. She wanted to be climate change and all that, and she had an A. And we went to a university, and she asked, I would want to come to this university to do this. And said, what did you get? An A. Then the head of department told her, but we usually get those who cannot get into medical school. And he said, why? So she ended up in medical school, although she wanted to do something which would lead her to the issue of climate change. So the mindset needs to be not just the students, the parents, the community, so that they can see the value added by these other courses. So I think it is for all of us, the media included, and everybody to begin to tell Kenyans, it's not just about degrees, it's about competencies. And that's what this competency-based curriculum is all about. I mean, if my son, who is an artist, and told me he wants to go sing, when he was in Form 4, he didn't want to go to university. He wants to go and become an artist singing.
Yeah.
And I've been horrified. I mean, what will become of him now 10 years down the line? But we need not to be horrified.
Okay.
You know, just now get that talent and try to nurture it to the highest possible level.
All right. Yeah. Let's take a quick break now. When we come back, we'll talk about number 9 and 10, FGM, GBV, and what quality reproductive health care really looks like and what it is. That is coming up in just a bit. All right, thanks for staying with us. Keep your feedback coming 22422. That's a SMS line. Let us know your name and where you're texting from. Text also tweet at Citizen TV Kenya, Trevor Mbija. We're talking about the 11 commitments made during the ICPD-25 conference. That's the Kenya chapter, the Nairobi summit right here in Nairobi. There's a lot of controversy, but we're talking about them now. 10 of them. We are at number 9 and 10. There's the 11th one as well. We'll tell you what the 11th one is all about. In fact, we have all of them now. Number 9 is to eliminate FGM by 2022 and eliminate all GBV and harmful practices by 2030. Number 10, ensure universal access to quality reproductive health services by 2030. And number 11, tracking the implementation of ICPD-25 Nairobi Summit through the National Council for Population and Development. And we have the Director General here. She'll tell us what a picture of success will look like. But first, let's go with number 9, which was to eliminate female genital mutilation by 2022. In addition, the country will eliminate all forms of gender-based violence and harmful practices by 2030 through the strengthening of coordination mechanisms and addressing socio-cultural norms that propagate these practices. Dr. Mbai, how will FGM be eliminated by 2022? What new approach will be put in place, and yet we've been trying to fight it all this time?
Well, like we said, these things are ongoing. It's not like we are starting from nowhere. The structures are in place. You know, we have the NGO board, we have the Directorate of Gender, we have several NGOs who are working in this sphere. But
where is the gap? How come it's still going
I think the gap is in the implementation. And what the president was bringing on the table is political commitment, which means then where there are issues which require political unlocking, then the government will get into that space and assist. One of the things which happened just before the conference was for him to have for the president to have a meeting with other heads of state of the bordering countries, because we know FGM is very complicated. If you don't offer it on the Kuria side of Kenya, they just go into the Tanzania side and have the FGM. So, you know, getting into an agreement that even our neighbors will support this initiative, so that, you know, we begin to make it difficult for those who are diehards, you know, to get the service. The other thing is you recall, we also had this conversation with the elders, you know, because some of these gatekeepers in the communities are really diehards in this area of FGM. So they need to begin to understand why it is not a necessity in this day and age. So I know we have criminalized FGM, we have an act and all that, and people have been taken to court and so forth. But what that now has done is to make it, people go underground.
Yeah.
You know, and you know, we heard of those Tarakanidi women who are even doing FGM on each other because of the social stigma, you know, including curses and children dying. So getting to the bottom of it at the community level. I think we need to strengthen those mechanisms a lot more at the community level to understand why it is not it's not the rite of passage for this day and age. And
what is the best approach for GBV?
Gender-based violence, that is it's a big one.
Yeah,
gender-based violence is a big one. We've seen a lot of actually increase in the last few years. And a lot of deaths also related to gender-based violence. So we need to, as a community, re-evaluate our values as a starting point, because some of the incidences which happen, really they are not even understandable why they reached that stage. So we need to re-evaluate our values. We need also to empower each other. I mean, not just the girl child, but also the boy child. Because sometimes from what we see, some of the cases which are coming to the fore, is the boy child is finding himself at, against the wall.
Yeah.
And I mean, they react in certain ways which end up with deaths of their partners, their spouses, and so forth. So I think there's a lot of need to also engage the men in this dialogue.
Yeah.
And I was also going to say in FGM, intergenerational dialogue is very important.
Okay.
This Masai Moran needs to feel that they can actually marry an uncircumcised girl and move on and say it and marry them.
Okay.
Yeah, then now we can begin to break the taboo that if you marry an uncircumcised girl, your children will die or something like that.
Okay, so it starts from the community.
Community up to, and also issues of suicide.
Okay.
Yeah.
We'll talk about that in just a bit. Sandra, GBV and FGM, practical approach. How do we end it by 2030?
Practical approach for GBV is, first of all, unpacking what that means, because what we normally do in these conversations is blanket with terminologies. We do not break it down, we do not humanize. So we want to talk directly to the young women, to the young men, to women and men who are victims and survivors of GBV and FGM. One thing that is missing and that we're really pushing for is access to justice systems, especially for those who are further marginalized from the system. So for instance, talking to mothers who face sexual violence, face gender-based violence, intimate partner violence, but also maternal health violence, which I really think needs to be brought to the fore. There are some voices that are being left out, where you find that mothers who interact with the health system are going through disrespect, humiliation, non-consented care, lack of privacy. Some of them are actually being sexually assaulted. There's something that came up last year in Kenyatta Hospital about the lift situation. But that conversation is not coming forward. And what you find is when these women speak out, stand up and speak out, they are either dismissed. If they do have access to justice systems, which more often than not, because of socioeconomic barriers, they do not have access to both judicial and non-judicial institutions, they are not listened to. And it's almost like they're trying to, in trying to reclaim their power, reclaim their body, reclaim themselves, that the system does not listen to them. So that access to justice needs to be rethought. That it's made more accessible to the ones who really need it.
And this applies to both FGM and GBV. Dan. I'm sorry, you're running out of time. Just trying to get you.
Sorry, as we ran out. Now, I think one of the reasons why I'm also here replacing my boss is that he's engaged in, right now he's moving with the CS for gender on issues of HTM. So the president has hit the ball, the road running in terms of because we keep putting out the commitment into practice. So there's a lot of that political commitment, and from the national and up to the ground at the community where the elders are involved. I want to talk about medicalization, other than what has already been mentioned by others in terms of the FGM, because we see the new trend, because there are new formalities other than just what is being done at the community level. This aspect where the medical expert or professionals who are supposed to be preventing this, but the ones who are perpetrating, where they cut even the infants or the newborns. That this is where now we're getting involved, we're engaging even the midwives to stop, or those who are the professionals to come against this, so that we stop this aspect of medicalization. I like the component of issue of the men, engaging the men, especially looking at the GBV. It happened also now from another perspective of rather than here at the workplace, is being a leader in the men of men in the church. The issue of empowering the men, the issues of boys to men programs, or Man Enough programs, which are run by Transform Nations, by Someone Baby, amongst other programs, which is quite key, that masculinity is not just expressed in violence, but the other aspects, including the loving aspect for the women. So then data is key. And most also, apart from data, because we need to know where FGM is taking place, so that you can. So we have got isolating the hotspot, what you call the hotspots, the counties which are conducting this GBV data, so that we can be able to formulate key interventions. Lastly, looking at now bringing up is education. Is key. Some of the issues are looking at the cultural practices that is that infant death is related to a woman not being cut. Okay. Surely that's not true. So we have to look at the education so that we prevent some of this. And looking at what we had started discussing, sexuality, some of the reasons why FGM was being practiced is to avoid, to lower the libido, so to speak, of the woman, isn't it? So that they don't become so hyper. So I think that's some of the places.
That is the cultural version of it.
Sexuality was being looked at even. It looks like what was being discussed even previously. Okay. And this has nothing to do with FGM. So we need just to educate people. Educate people.
Right. Dr. Mbai, I'll give you the final say on this to respond to number 11. You have been directly committed by the President to track and monitor the implementation of the ICPD-25 Nairobi Summit commitments through the National Council for Population and Development. And also, what does quality reproductive health services look like? That's on point number 10 as you wind up.
Okay, maybe going to how we are going to track and monitor. It is our mandate as the council. That is what our legal notice implies. We are supposed to coordinate population issues in the country, and most of these things, as you can see, are not specific health, are not specific education, are not specific gender. So that multi-sector approach is what the President is reminding us that is actually our mandate as per our legal notice. So the way we plan on doing this, of course, is to have a multi-sectoral technical and policy steering groups, which will help us come up with an action plan, which will have specific indicators and targets, so that this can also be included in the national monitoring and evaluation framework, which is already there under the State Department of Planning. So that each sector is able to track what we said we would do this year, next year, and so forth. And then, of course, for us, we'll be reporting annually to Parliament and also to the government at large.
That's why we have to leave it for now. We've really run out of time. Dr. Geoffrey Kithuku, Director General, National Council for Population Development. Dr. Dan Okoro, UNFPA Head of Programs, asante for making time. Mr. Geoffrey Kithuku, Stretchers Youth Organization from Mombasa, asante for coming in. And Sandra Mwarania. Did I get that right? Health Rights Campaigner, Amnesty International Kenya. Thank you for making time. Let's see what you're saying online. 22422 is SMS line. Trevor Mbija at Citizen TV Kenya. Governor 254 says, delivery of good quality education is ultimately contingent on what happens in the classrooms. The teachers are in the front line of the service. The most important determinant of educational quality is the teacher. He continues to say the girl child continues to be in vulnerable situation. Parental gender bias, cultural norms, negative impacts of HIV and AIDS, pandemic, and poverty continue to impact adversely on the girl child's participation in education. All right, let's see what you're saying on 22422. That's our SMS line. Text us your name and tell us where you're texting from. Dr. Odidi Owiti all the way from Lodwar. If any resolution goes against our values, ethos, and tenets enshrined in our constitution, the ICPD-25 would just face the same fate as the one that befell Beijing conference. All right, that is also something the president mentioned several times in his statement. Comment from Eldoret says, last year during national exams, the attention of authorities was drawn to the number of candidates who were expectant or delivered during the exam period. The ministry officials promised to address the issue. Indeed, this year, very few of these cases have been reported. The question is, how was this addressed, which was never being done before? All right. Fanuel from Migori says, it's high time the government of Kenya wakes up and works as a government. For me, Kenyan government has failed in everything. Policies are there and clear, but corruption is in the trade of the day. Also, create entrepreneurship platform opportunities by licensing youth innovations and reduce the cost of doing business in Kenya as it's very high. All right. Seme from Kitui says, on elimination of teenage pregnancy, it is both parental role and government's role. One, the government should come up with adolescent centers where adolescents can share their health issues, including sexual-related problems. These centers should be accessible to all teenagers and should be adolescents friendly. This will help teenagers access the required information and use the information effectively. And number two, is still the same from Kitui, says it's upon the parents to check on the social and psychological condition of their teens. The modern parents tend to assume that adolescents are big people and they know what they should do, which is too wrong, because teenage period is an experimental period. They will tend to practice anything they hear or see. So parents should get close to their children and discuss sexual issues with them. She still continues to say, number 3, lack of access to services and information also affect the health of adolescents, since this is the group that least seeks health services. They would rather visit a chemist and buy painkillers than going to hospital. Health education and promotion in hospitals and certain institutions where adolescents are will help them get the correct information and get rid of the risk factors related to transmission of HIV and AIDS. That's Seme from Kitui. Thank you so much for that comprehensive text from you.